This is Conversations in the Clinic. I'm Dr. Kelly. I had a great experience yesterday at the dentist. I had several great conversations with the hygienist. Now I'm going to put a disclaimer out there. My dad and brother are dentists, so I go to their office. And I adore the hygienist that they have. Their whole staff is great. And my hygienist and I, probably like your hygienist and you, have a great rapport. We check in every 6 months. I go there. I actually have to go every 4 months because of the way my mouth is and the way the plaque builds up. So we see each other a couple times a year and we check in on each other. How's life? How's the baby? How's everything? Business, everything. And recently I've had to start going every 4 months because of the way the plaque has been building up. And so I've been trying to be more diligent about brushing my teeth and flossing so that I can go back to going every 6 months. And we had some, I was bleeding a little bit yesterday after the cleaning. And I said to her, Josie, no matter what the real answer is, tell me yes. But, and she kind of laughed and she was like, okay, don't ask the question. And I said, no, I need to ask the question and I need you to tell me yes. How much does what I'm eating affect the plaque that's building up here? And she was like, yes, yes, it does absolutely affect how much plaque is building up and the state of your oral hygiene. She says, we talk about it all the time, right? Like sugar and carbs sit on our teeth and that's what causes decay. And I said, so if I improved the stuff I'm eating, I might not have to come here every 6 months, every 3 months, every 4 months, excuse me. She was like, maybe, like your genetics play a role in it. The amount of saliva that you produce, like there's a lot of factors that go into the plaque building up and the decay that can happen. But yeah, if you didn't eat as much sugar or carbs, you probably wouldn't have as much buildup. So I said, okay, great. And then we got into a big, long discussion, and she's Dominican. So her family is from the Dominican Republic. She talked about her grandparents and what they ate. They ate rice and beans. Like they ate carbs and protein, and then they ate eggs and they ate, milk that came from the cows that were in the backyard. And we got into this big, long discussion about our American diet and what we eat in the Western world now and all of the chemicals that are in our food. And it made me think about like 50 years ago, 100 years ago, we probably should have been going to the dentist every 6 months and brushing and flossing every day. But because of now the lifestyle that we have, that's an absolute necessity. The field of dentistry has exploded. And I think a big part of that is because of the diet that we're eating and the food that we're putting in our mouths every day, starting from a really young age, right? We're drinking coffee, we're drinking soda, we're eating snacks from 7-Eleven, and it comes at the cost of like convenience, right? So that's the first part of the discussion was not just the food that we're eating is affecting like our health and our cancer rates and our diabetes rates and our metabolic syndromes. It's affecting our oral health, which like, duh, I guess, but I had never thought of it like that. That was the first thing. The second thing, and I've said this for a little while, is I want to start treating movement hygiene like dental hygiene. Like we live in a society now where if you work out and you exercise, like that's extreme. But if you don't brush your teeth, that's disgusting. Like I want to live in a society where if you don't work out and exercise, that's disgusting. What do you mean you didn't take your walk today? Right? Like that's what we would say to someone if they didn't brush their teeth. What do you mean you didn't brush your teeth today? It takes 2 minutes. It's really good for you. It prevents a ton of issues down the line. Your breath will stink if you don't do it. Like brush your teeth. We could say the same thing literally about like get on the floor and get up and down off the floor. What do you mean you didn't get up and down off the floor today? Don't you know that that's like a really important thing to do to prevent future injuries and big surgeries and that kind of stuff? Duh. So those were two really important conversations that I had about food about dental hygiene. And then the other thing, and I have to plug my own clinic here, is like, what if we went to go see a physical therapist twice a year? What if they moved us around and checked our movement patterns the same way that the dentist and the hygienist clean our teeth and look at our teeth to make sure, like, hey, nothing going on here. Things look good. Hey, this is a problem spot. Let's keep an eye on this. Hey, here's an issue. You're having pain with it. Let's fix it. Could you imagine the number of surgeries we'd prevent? Could you imagine if physical therapists use our whole scope of practice, which includes the cardiovascular system, which includes the nervous system, which includes the musculoskeletal system? Like, if you had a provider like that, you'd be healthier and you'd be happier. So that's what I'm trying to start to do now. It's January 7th, and I have 5 or 6 people coming in this week and next week to do what I'm calling a wellness assessment. We're going to look at full strength, full mobility, and lifestyle factors, and then come up with a plan for those people for the next 3 months to get them into better habits, to get them moving better, which they know and I know and the whole world knows is going to help them live better. Um, so that's where we are. You're supposed to be the change you want to see in the world. That's what I'm trying to do here. I think the dental model is a really, really good one and a strong one. And um, that's where I want to see things go. I appreciate you. Thank you for spending your time and your attention with me today. Keep moving and keep getting better every day.